I'm not prepared.
Okay, so good afternoon. We are talking to Professor Y.Y. Chen and his amazing research on migrants and health. Professor Chen, why don't you tell us a little bit about your research, how you got interested in your area of research?
Sure. As you mentioned, my research work really sits at the intersection between health and international migration. And just there are a number of issues that can arise when these two fields of law happen to coincide, right? So one issue that I've been working for the past few years has been on the issue of refugees and other migrants' right to health care, right? To what extent should they be included in our so-called universal healthcare system, right? And if they're included, should they be given the same kind of healthcare? Or should there be some kind of spectrum that we're thinking about, and where do we draw the line? And so all that requires some thinking, right? And also the reasoning behind it, why we are drawing the line this way as opposed to another way. And so that's one issue that I'm currently working on. In the past, I've worked on issues such as something called medical tourism. So this is when people actually travel to, let's say, somewhere in Southeast Asia, for example, and they actually pay for healthcare. And the reason they will go there is probably because they just either wait time or some cost issues specific for patients from the United States that they prefer to go abroad to receive healthcare. And then again, there is some ethical and legal issues associated with that. So those are some of the issues that I've been tackling.
That's super interesting. So can you tell us how you got interested in this area of the law and how you started your career in working on this issue?
Right. Well, I, as an immigrant myself, right, I think a lot of the issues that I work on has a personal touch, right? My parents, when they first came to Canada, they struggled a bit in terms of finding appropriate service provider, and so that was something, just looking at that experience and having to do it for quite a number of times, to have to translate for my mother, for example, right? Going to some of more private healthcare meetings with her healthcare provider. You just feel like there's got to be a better way to do things. And so that's what really piqued my interest. And then my career started as a social worker. And through that process, that also allowed me to interact with patients who are either immigrants, refugees, or people without any kind of legal status in Canada, and how they access healthcare and some of the barriers that they face. And in that context, we're looking at people who are also living with HIV, right? And so access to medication was a huge issue. And so that, eventually took me to law school. I thought going to law school would be helpful for me to learn about what kind of policies are needed to put in place to ensure people's access to healthcare. And here I am. And it's actually by draw of luck that after law school, I started articling at the Canadian Civil Liberties Association. And what do you know? The first file that I got, that I got to work on, was the Neil Toussaint case, right? So at the time, Neil Toussaint is a person without legal status here in Canada, and she was asking for the federal government for some public health care benefits that the government said no. And so the Canadian Civil Liberties Association was thinking about intervening in Toussaint's legal challenge. And I got a file and I was told, look into this, and we don't know much about the interim federal health program. Can you tell us what that is? And all that, right? And ever since then, here I am, right? I'm still researching that topic.
That's so fascinating that you're working at the intersection of migration and health, and that it's been informed by your personal and also your professional career in a number of ways. So can you tell us a little bit about the challenges working in this area? What have you found to be challenging about researching in this area, or perhaps what's been challenging about talking to people about their ideas about migration and health?
Well, I mean, working in this area, it's often not easy, right? Sometimes, sometimes I try to engage the public by, for example, publishing something in the popular press, or sometimes you'll give interviews to the media. Initially, right, as someone who's just very open to wanting to engage with the public, you will want to know what people's reaction is. But after a while, you learn not to look at the comment section, for example, because oftentimes, different things will be tossed, at you, and they're not the best. It didn't show the best part of the people, and so those are some of the things that I think is the hardest working in this area. People often question why we're even thinking about healthcare for these group of people when Canadians are not receiving adequate healthcare, which is true. My mentality has always been that there's a way for us to work together such that everyone can be included and everyone can receive the kind of healthcare that we believe that we deserve. And so it's having to manage that kind of public reaction and have to explain to people, and sometimes people are not clear in terms of all the refugee process and Canada's responsibility in taking in refugees, for example, and what's the difference between irregular migrants and why can we not call them quote unquote illegal migrants, right? So all those things. They're very nuanced discussions, and it requires patience to talk to people, and sometimes you have to just kind of grow a thicker skin when names are thrown at you, or you're challenged really head on, right? And I've been told to get back to China, right? Like, even though that's not where I'm from, but it's part of the work, and sometimes when you do see positive results from the work that you do, there's a sense of satisfaction. I think it's hard to
tell us more about that too. I'm interested to hear what you found has been the most exciting part about doing work in this area and the research that you're working on.
Right, and I mean, obviously the most something that's more recent, right, that I can think of was the success of the interim federal health challenge, right? So challenge the cut that was brought in by the previous federal government in 2012 that literally gutted the program, and
this is a program that provides health care to refugees and refugee claimants.
That's right. And so a lot of refugees and refugee claimants, as a result of that cut, were left out of our healthcare system, right? And there was well documented negative effects on people's health, as well as to our healthcare system, right? Because now healthcare professions are forced to have to deal with some of administrative work and have to advocate on behalf of their patients and all that. And so at the end of the day, everyone was affected. And then there was a group of doctors and lawyers that decided to work together in a fashion that I don't think I've seen before. There was quite a bit of energy from both sides, right? And really wanting to mobilize on this issue and press against the government to say, look, this is not only against Canada's long committed principles to human rights, but it's just literally it's inhumane, right? At the very core of this issue. And so, after quite a bit of hard work, both outside of the corp and within the legal system, finally, first we got that legal success at the federal court. And so that forces the then federal government to make some adjustments. And then, with continued advocacy, the current federal government decided to reinstate the program to what it was prior to 2012 in April 2016. And so that to me was a success story. I play a very small part in this, right? But the whole story is something that I find energetic, right? You can see that at least some of the effort that I put into actually resulted in something that's a positive outcome for a lot of people. And so yeah, that's something that keeps you going for a while.
That sounds great. That is a very inspiring story. Like you said, different groups of people who don't typically work together are very often who come together to work on a common cause.
Right.
If you have one piece of advice for any first-year student starting their career here at the University of Ottawa, what would you tell them?
I will tell them what I said to my students who asked me that question before, which is be collegial, be supportive to your colleagues, right? As much as you think that, there are many lawyers in Canada, it's actually, the legal community is actually quite small. And a lot of times you live by your reputation, right? If you have great reputation, you're going to lead to a much more successful career down the road. A lot of the people that you're in class with ultimately going to be your peers. So, start fostering that relationship early on. Try to lean on each other, and be respectful to each other. At the end of the day, you're all going to be colleagues, right? And so if you take that mentality, I think that will improve the way that you approach law school, approach your interaction with your colleagues, and your outlook in your career.
That's great advice. I think that's so true that from the beginning, day one, you should act like a professional, right?
Yeah.
And act as if you will enter the legal profession already.
Right.
That's great. Thank you, Professor Chen.
Thank you.
We're grateful that you've shared your time with us.
Thank you.